The doctors are already out. They're home. That's what I want. That's the clear thing, that the hospitals in Kiambu County, doctors are out because they cannot afford to be at work. They even risk their doors being locked by the landlords if they get out of their houses to the hospitals.
Can be no power greater anywhere beneath the sun. Yet was force on earth is weaker than the feeble strength of one. But the union makes us strong. Solidarity, solidarity forever. Solidarity forever. Solidarity forever. For the union makes us strong. Viva KMPDU, viva! Viva! Long live union, long live! Long live!
A pressing matter, and I know all of us, this matter of social health insurance is a matter of concern to every Kenyan, and particularly to the health workers who can't afford the health care that themselves offer. We had a strike that went for 56 days that gave clear outline agreements with the government that they will provide comprehensive insurance. But up to now, 2nd of October, most of the counties have not complied to this. And again, the doctors who are seconded to the different counties from the national is yet to give us a report on the progress of the comprehensive cover. Yet we are seeing our pay slips, as per that rollout yesterday, are going to be deducted huge sums of money. So we want to tell the government that they must respond and give health workers and give workers the comprehensive cover as expected, and comply to the agreement of the third work formula dated 8th May 2024. Otherwise, we will not give any further notice for action. We also agreed in that third work formula that doctors will no longer be going to work unless they pay their salaries on time. We have a dire situation where doctors in Kiambu County have not seen any salaries for the month of June. And therefore, it is not expected that they should be at work. We've had discussions, and there are many things that have been derailing health services in Kiambu County. One, the shortage of doctors. The doctors have not seen their promotions, and the doctors have not been paid their salaries. Again, their health insurance they've not had despite engagement with the county over the last 1 year. So as we speak today, the residents of Kiambu County are not going to have any services from the doctors because the doctors are out of work. They are out of work not because they want to be out of work, but because they have not been paid their salaries and they are able to go to work. And therefore, unless the county processes the salaries from the month of July, August, and September, no doctor will be seen in any hospital in the Kiambu County. We also bring it out very clearly that there are incidences of suicides that have been witnessed in the Kiambu County. And one thing that has exacerbated this incident is burnout. We saw 2 weeks ago when one of the doctors died by suicide. We have had 3 incidences in the last 6 months. And we are saying as a union that we have a collective bargaining agreement that is clearly stipulates the number of hours that doctors hold to work. As we ask doctors across the entire country to ensure that they work 40 hours a week, the hospitals were built before you finish medical school. It's therefore important to do your 40 hours and leave the hospitals. And we are telling doctors in Kiambu County in the same way that we have to implement 40 hours a week. The issue of 80 hours, the issue of 100 hours has to stop, because the government has a duty to employ health workers. If they're saying they're going to roll universal health care, if they're saying they're going to roll UHC, if they're going to tax Kenyans, they have an obligation to ensure that these funds are able to employ health workforce so that can deliver those particular services. It is not right for us to pay heavy on social health insurance and have dysfunctional public hospitals in the counties. As I say this, Kiambu serves an example of our actions in any of the counties that will take the issue of payment of salary as a privilege for workers. Any county who shall have delay in paying salary by 5th of every month as agreed, the doctors will be out of work. Thank you. We all know very well that we have had engagements with both national government and the county government for over years that even culminated to the strike that we had in the month of March that ended in May. We have now an obligation. The counties have obligations to meet the end of bargain, which is a court order. And therefore, we don't need any further engagements on the precept of inefficiencies and excuses. We need implementation. It is not possible that 40 counties pay salary and Kiambu does not pay salaries. It's not a matter that we can bargain about. It's not something we can discuss. It's just like the issue of internship. We keep on saying that if you're expected at the place of service, you're expected to be paid. It's not a matter of discussion any further on that. The matter of social health insurance, the matter of health insurance. Kiambu County, as of last year, had taken a sub-level, rather rudimentary health insurance that was demanding doctors to go to the hospital and pay their bills before they demand for reimbursements. And we took them to court over that. That particular cover is called by MOA. It's still bad. And that's why in our return to work formula, we wrote clearly the standards of cover that each and every county ought to implement, which is based on SRC and PSC guidelines. So up to now, they have not done that. And therefore, it surpasses the deadline. So as we give this demand, we are saying all the counties across the country, we have demands that what to be implemented. We'll go for individual counties who are not implementing the agreements and take actions in them. As of today, we have taken action on Kiambu County. Kisii strike was to begin today, but then the doctors have met with the Kisii County and have an agreement on how these things could be implemented. We have given a notice to Migori County over the same issues. So Meru County are on strike on the same matters. So we are saying, yes, we got a collective agreement nationally, but it is the responsibility of each and every county to ensure that they implement these things. It's an efficiency, it's an administrative problem of a county. It's politics of the county and national to delay payment of salary of doctors. So as doctors, we are saying one thing. We don't want to be part of the politics. We go to work and we ought to be paid. That's all. Rolling social health insurance and promising functional or access to health care. It is impossible to do that when we have an aspect discrimination and disillusionment of doctors in the counties. It's not possible to actually rush to roll these things because, I mean, this is the first time UHC is being launched or these things are being rolled out or policies are being rolled out in the country. But they don't look at the aspect of service delivery to the people. Because you can't explain why a county will expect doctors, will expect health workers to be at work when they can't pay these people. But they can buy infrastructures, or can buy equipments, and can fill all those particular hospitals. So this is just a fight not for salary increase, but for right and justice for the workers. And the counties was the matter that the county openly discriminated payment of some doctors' salaries and disobeyed the court order that was in existence. So they were to proceed on strike, but the county committed to pay this month. And that's why we took a hold of it. Kiambu is very important to us. It should take its weight. It should not be overtaken by the issue of SHA. But I must say that as per the union, we had repudiated SHA in 2023, both in our submissions in the court, submissions in Parliament, in the Senate. And there's one aspect that we say, that there's no way we can talk about universal health care when we have provided payment in law. It means the insurance becomes useless if you are being told that your payment will be dependent on the hospital that you visit, and then they assure at the same time that the public hospitals are dysfunctional. That's one. Number two, the government was just to make all Kenyans have access to comprehensive care the way civil servants were having, not reduce everybody to a basic insurance. So those are the things we've been talking about from the beginning. We've also said that the management of SHIF, why had it to go? Why must it be good for private sector? Because it's a clear thing that it then it's going to manage the private interest. Correct? Public money taken the private sector. That is what we said before. And the only way, and we keep on saying, universal health care for this country is a dream as long as it's a political statement, a political thing. And it will remain a dream because you don't have a functional public health care system. There's no investment that are doing it. Like now we are talking about, fighting about interns being paid 5 billion when we are putting 110 billion in the tablets and network for SHIF. We push the implementation of the issues in the counties. Kiambu County as we escalate to other counties. If the counties are not responsive, we will not fail to go for national strike. We don't get tired.
Yes.
Because and we have come to realize that the first tool to utilize and the first power for workers is being on strike.
Yes.
So Kiambu is leading, and all other counties will surely follow.
Mama litasimama, mambo yote yatapita, lakini chama litasimama.